Gaps between teeth are quite common, okay, and this is because we have got an arch size which is much bigger compared to the size of the teeth. It doesn't necessarily mean that your teeth are small, but there is a difference between the arch and the size of the teeth. That's when we end up seeing quite a bit of gaps between teeth, and it's quite common for us to see patients who are not obviously happy with the gaps between the teeth and they come to actually correct them. So how did we correct it from there to here? We used Invisalign braces, which is aligners, which uses attachments and aligners to actually move the teeth around. So we used them to correct and close the spaces. It took slightly over a year to correct this bite, and we got from there to here. Along with that, this patient went through something called phrenectomy. If you see on the top picture, you can see that there is a thick gum part which is in between the teeth. When our teeth grow, this part of the gum should actually go closer to the upper lip. Sometimes it stays below, and that can actually prevent the teeth from actually closing when we close the spaces. So it's quite important, if there is a low frenal attachment, then they need to be snipped by an oral surgeon, so that once the treatment is over, the chances of the gaps remaining closed is quite higher. So this patient completed the treatment using Invisalign aligners, and then it was followed by retainers, which they had to wear every night as long as they want their teeth straight. If you have got gaps between teeth and you're unhappy about it, please come and see us, or speak to a specialist orthodontist who can use aligners or fixed braces so that they can correct this for you.